From that, today we're shining the spotlight on a life-changing health initiative led by Haven of Love Children's Foundation in partnership with the Global Impact for Rural Innovation Foundation. Well, it's imperative I tell you that this outreach brings free cervical and breast cancer screenings to women, especially in rural communities. I'm sure you're wondering, October is over, but hey, it's still important that we do the sensitization about breast cancer. Well, joining us in the studio to have a conversation on this, dedicated team of doctors and organizers behind this initiative, and they'll be walking us through all they have in store for you. They are with me in the studio. I have with me Samuel Nana Bekai Jirako. He's CEO and founder of Haven of Love Children's Foundation. He's also the winner of the Health and Social Welfare category for the 2024 Joy News Impact Makers Award. He's in the studio with me. Also, I have a lady that her name is quite impressive for me. In fact, when I first met her, I told her, pronounce your name for me. She is Obipisebia, right? Did I get it right? I'm trying. She said I'm trying. Don't worry, we'll super the names for you. But she told me I can call her Prissy or Priscilla, right? Agakoba and Fachu. She is a fellow of Royal Society of Public Health, rural health advocate and founder of GIRIF. She also promotes screening of cancer in rural community and in Africa. I also have with me Dr. Nana Konedu Dako. She's a specialist in family physician and family physician. I beg your pardon. I appreciate your time. And I'll start with Prissy because I think our audience should first of all know how your name is pronounced. Don't you think? Yeah. Please pronounce your name for us.
So my name is pronounced Obipisebima.
Oh wow.
Priscilla Agokabo Fachu.
I tried, please. Okay, so tell us why you're doing this initiative and what we should look forward to.
So basically, we've come to realize that as a rural health advocate, some women within the rural community suffer from breast cancer and cervical cancer, and these are diseases or viruses that could be eliminated at an early stage. But because the awareness is not there and the facility is not there to go into the people, to go to the people and advocate for it and give them the treatment they need. So we came up, Heaven of Love and GIRIF, we decided, okay, since we have the passion, let's go into rural health advocacy and help the people, the rural women there, get them tested and able to flip the situation. So before it becomes critical, let's get them treated at the early stage.
And then let me come to Haven of Love. When is this happening? Which areas are you targeting?
Okay, so it's happening on the 26th to the 29th of this month, which is November. We are targeting Boku West, rural communities in Boku West District, Garu District, Timpani District, and Binduri District.
And we're looking forward to that. But let me come to Doc because we need to do some education here. For most young people, we only get to find out about cervical cancer at our later ages. And for most people who report in the hospital, they arrive at almost the late stages of the virus. Tell us about how to spot it early and what we should be looking out for when it comes to our health.
All right. So you pose an important question, how to spot it early. And the challenge with cervical cancer is that it doesn't show any symptoms. Okay, so if you want to spot it early, you have to screen through all the screening modalities. And that's why it's so important to go into the rural areas because the problem is access and accessibility. Access to facilities where they can have these tests done, access to the specialized individuals that do these tests, and access to the screening tools and the early treatment modalities that are available. So it's so important that you screen because you won't have any symptoms. By the time you start experiencing symptoms, it's actually at the late stages. That's when you start seeing the bleeding after sex, bleeding in between your menstruation, bleeding maybe even after you've reached menopause and you are still having spots and bleeding. As for weight loss, bone pain, those are really late in the game. But it's so important to know that it doesn't have any symptoms at the beginning, and therefore it's so important to screen early and be treated and get that precancerous lesion and treat it in time.
But then, for most people wondering, can it be passed on genetically with cervical cancer?
So it's not something you can inherit, if that's what you're asking.
Okay.
It's something that happens after repeated damage and repeated infections of the cervix and the changes that happen in the cell. And it sends that part of your body on a journey that leads it to cancer. Let me just put it that way.
Can we say that it's sexually transmitted most often than not?
So the cancer itself is not sexually transmitted. You cannot sexually transmit cancer. However, the initial damage to the cervix comes from a sexually transmitted infection. That's why you have your HPV viruses that are involved in the transmission of cervical cancer. Yeah.
And let's go to breast cancer, because for most women, it's usually during October. We get the sensitization, screen, do your test, make sure you're safe. But is this something we can prevent?
So, early detection saves lives. I think that is the most important thing, because you can do everything to prevent. You can eat the right foods, you can have you can look at all the risk factors and do something about them, at least the modifiable risk factors. However, the thing to know is that doing all those things does not mean you can never get the cancer. That's what we must all know. Just because you make all the right decisions does not mean that you will not get breast cancer, you will not get any kind of cancer. That's the importance of screening. So with breast cancer, it's important to screen. If you don't have anything available at all, at least clinical breast exam, it's important that we all know our breasts. And then beyond 40, it's important to do a mammogram or an ultrasound, depending on the nature of your breast. That's why it's so important that we have these foundations here who are providing these services, at least the basic services, to people in the rural areas that have no access. The real problem is no access. No access.
Let me come to Samuel, because now you're granting the rural communities access.
Yes,
tell us how widespread would be the campaign, the number of women you are targeting, and men as well?
Yes, please. So everything we are doing is tied to finances. So for now, we are looking at 2,000. So if we can get support, and I want to say thank you to Joy News for giving us this platform to have this advocacy. So we've been pushing the advocacy alongside Gareth and Priscilla towards letting people see what we are doing. But we are a young foundation that has no resources, because young people have come together who are patriotic at heart to make change in society. We don't have the funds. We are young people. So if we can do this by ourselves, putting resources together, how much more can we do if we have more support? So we want to do 20,000, 50,000, because there are people there who are prone to some of these things. And many people die thinking they have died out of witchcraft. They have died out of maybe something they don't know they died of. Perhaps it is cervical and breast cancer. And we need support, financial support, to get this done.
Okay, let me wrap up with Prissy, really. You need money, clearly. How can they reach the foundation to support financially? And then finally, would you be going to other regions?
So we have our website, our social media platforms. We've got our flyers, and we have a brochure here.
Okay.
And we'll be so glad if Joy News could also help us, show our contact details up there.
Okay.
And we will be targeting the Upper East region first, and we'll try to measure our success rate. And from there, we would move to the different regions. I would also like us, from there, we'll move to the central regions, because the women there are not really aware of what cervical cancer is and what breast cancer is. And we want to go there. We already have people on board, like Mrs. Callis, that is founder of Clinic Mentorship. So we have them on board. But we want to make sure we succeed at this one we are doing currently.
And thank you so much. And this is why we do the Joy News Impact Makers Award, to put a spotlight on great activities and young minds like Haven of Love Foundation. And this is actually the brochure, you can come to Joy FM. You can actually come here if you want to partner them to have this done. We'll be providing their numbers to you so that you can reach out to them and help make this a reality. My name is Faustina Safo, and that's how we wrap up the polls. For more news, please log on to myjoyonline.com. Good afternoon.